Welcome to Ampla Health. Starting from humble beginnings as a small night clinic project in 1964, the goal was to provide healthcare services to migrant and seasonal farm workers, low-income population.
My name is Teresa Thornton, and I started working for this agency actually September 26th of 1975. At that time, we were called Northern Sacramento Valley Rural Health Project, and that's exactly what we were, was a health project. There was a small clinic in Yuba City that was a night clinic. So we contacted them to find out what their services were and what their grant opportunities were, and we joined with that team. We had determined that we had a need to try and get some health funding because the local county hospitals were closing and there was no longer any access to the uninsured patients within our communities. And so if you weren't enrolled through Medi-Cal systems or you didn't have private insurance, which the majority of our patients are seasonal employed, after the canneries stop or the forestry products or the parks close, they do not have any insurance after November for approximately 6 months.
What was once a medical care project quickly became incorporated in 1973 as a nonprofit organization called the Northern Sacramento Valley Rural Health Project, Inc.
There were needs for other communities to have these same services. We were reaching out to other agencies to find out what those needs were.
As the overall community needs for access to healthcare services grew, so did we, and expanded our services from Sutter and Yuba counties to Butte, Colusa, and Glenn, to also become a community health center and meet the increasing demand by providing services to all people, regardless of their ability to pay.
My name is Lilian de la Torre. I'm 82 years old. We've lived in this area since 1990. And I am very satisfied with their service. Ampla Health has helped all people, not just the elder culture, but everybody. Everybody that's in need comes to Ampla Health, and we know that Ampla Health will help, because that's the mission that Ampla Health has, to help the community, to help the one that cannot get the help that it needs by itself. And that's the satisfaction that Ampla Health has, is that we can satisfy or we can alleviate the needs of the community. That's our goal.
After an additional name change to Del Norte Clinics in 1993, we rebranded our corporation to Ampla Health in 2011, committed to improving people's lives in our community. Ampla Health is now one of the largest primary care health centers in the Northern California region, with over 500 staff members, proudly providing high-quality comprehensive healthcare services within 6 rural counties, including Tehama County now. Our centers are well-equipped and located in Arbuckle, Chico, Colusa, Ridley, Hamilton City, Los Molinos, Magalia, Olivehurst, Orland, Oroville, and Yuba City. We're operating almost at $70 million budget, serving close to 71,000 unduplicated patients with over 316,000 encounters per year. We're doing wonderful things for our community, providing medical, pediatric, dental, chiropractic, behavioral, social, and specialty services to people of all ages, regardless of their insurance coverage or ability to pay. Our mission is to provide the individuals and communities we serve with high-quality, comprehensive, community-directed healthcare that is accessible to all and culturally and linguistically appropriate.
Hello, my name is Horacio Paraz, and I've been on the board of directors for Ampla since 2013, and I'm currently the board chair. And I thought it was just medical service, but we have dental, we have chiropractic services, we have behavioral health, telemedicine, we have a lot of other things that are just awesome, because people need the services and we're providing those services to people locally. And so, since I started about 6 years ago, I've seen a lot of change, a lot of growth in a good way for Ampla and for the people, our patients. One of the areas that I think is very important is providing transportation services to senior citizens. A lot of these folks really don't have a way to get to the doctor. And so if we're able to provide them a service where they can call in, they can schedule an appointment, and we can go pick them up and drop them off, I think that's outstanding. I think we're one of the few clinics probably that are providing that services.
Ampla Health continually work towards strategically positioning itself to better serve our patients.
My name is Ben Flores, and I'm the President and CEO of Ampla Health, and I've been doing this since 2009. Ampla Health is strategically positioning itself to develop programs and to expand the current services within the communities that we serve, so we can expand and we can serve more of the individuals in our communities.
Patient satisfaction and continual development and expansion of services are important to us.
Some of the clinics that we're planning to expand or build as new facilities include the clinic in the Richland community, the Richland Medical Clinic. Also, we are planning to expand or build a new dental clinic in the Chico area. We're planning to build a new facility for the pediatric clinic within the Yuba City campus here in Yuba City, and also to create a new dental clinic within the Yuba City area, which we currently do not have.
We started a clinic up in Magalia in Butte County, which is serving a lot of people in that community. And we're looking at other areas. We're looking at expanding, maybe building a new clinic in Chico. I know we need one in Colusa. We have an old clinic there, and hopefully we can buy our own building, our own property, and build a clinic. And I've seen a lot of good things come out in the past 6 years. And I think it's because we've been working, the board, working along with the administration, the CEO, and the staff, working together. And so, yeah, I'm really happy because I've seen all those changes. And it's just in the short 6 years that I've been here. So it's really neat to see that.
Ampla Health, we strive to continually be the primary healthcare provider of choice and to count on great leadership from board of directors to executive and management team members.
As a board member, I kind of help steer the ship that way, and then it's been in the staff's responsibility to make it happen. And so yeah, it's great to see it, and just being part of that team, it's exciting. So I think I'm really happy to be here, and we'll continue to work to make it better for people.
Well, I am very proud to be the leader of this organization. It is an honor for me to serve the patients that we serve, and it's a privilege to work within the team that we currently have. It just makes it easy. We're very happy to be here.
In the entire Ampla Health family team, employee satisfaction and continual development for career advancement is also a priority to us.
What has kept me here, I think, is job satisfaction. I think it's important when you spend more of your working hours awake with the people that you work with and the services that we're providing. It's important that you like what you're doing. And I really enjoy what I've done. It was never my intent to get into medicine. I had an art major, and I was doing demographics, like I said, for my grenade. But I also had minored in business, and it was just rewarding to be able to take that business aspect and bring it in and providing services in something that benefited people. And it's just a rewarding career.
Being part of Ampla Health has been one of the best experiences in my life. These last 10 years have been very rewarding. The growth that we've experienced is amazing. The staff that we have is been developing into a very strong and supportive staff. The board of directors is awesome. The team is great, and being part of it is one of the best experiences that I have. I still want to wake up every day and come to work.
We face important challenges, but we are committed to our mission, to our patients, to our staff. Certainly, there are things that we need to improve, and we count on your continued support to do so.
Well, I believe that continual development and expansion of services is so important, and that's one of the missions that I like about it. We're all the time putting any of our proceeds back in to buy new equipment or to expand or build new facilities. Along with that come new additional services that we're able to provide.
It is important because at times There are services that we do not provide, and they're necessary for the patients to have. And developing these strategies and partnerships with communities, we can have the assurance that the patients will have the services that they need, and they will not go without some diagnostic services such as x-rays or laboratory, or even the getting the pharmacies and the medications they need.
This is who we are. We are Ampla Health, and we are proud to be part of this wonderful family team with a greater mission in life to improve people's lives. Thank you for being part of what we do.